Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxy, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back to the show, COIQ listeners. On today's episode, we have John Hui, who is the CEO and co-founder of Tweeage. John, welcome to the show.
Thank you for having me, Roxy. Pleasure to be here.
It's so great to have you here, and I am very interested in this conversation today. So first off, let's just tell our listeners a little bit about you, your background, and what you've been innovating.
Sure. I am a serial healthcare entrepreneur who has been working in the healthcare industry for almost 20 years. I run a digital health startup company called Tweeage based in New York City. We provide a novel communication and triage technology between hospitals and ambulances. Now these days we're very busy to help our customers, which are either ER physician, nurses, or first responders, continue to refine our solution to combat the COVID crisis.
So John, I remember from our previous conversation, you found yourself in a very unique situation earlier this year that kind of positioned you ahead of most innovators, most people, but most innovators as well in the U.S. Share that story with us.
Sure, that's right. Unfortunately, I was visiting China due to my dad's illness in late January. The second day after I landed in Shanghai, China, the Chinese government shut down the city of Wuhan, which was the original epicenter of the COVID crisis. So I have been trapped in the hotel rooms for almost 9 days and witnessed firsthand how severe the COVID crisis could be. So after returning back to the US, I assembled my team to actually come back with a package helping our first responders to deal with COVID. At that time, the sentiment of the disease was not that big, even among a lot of emergency care professionals. But we were able to get ourselves ahead of the game to really design a clinical triage protocol, help our first responders and ER professionals to prepare in advance about potential COVID. And fast forward to early March, when COVID situation gets worse and worse, we were able to roll this out to all of our customers. And since then, the usage has been really through the roof.
So John, there's so many layers for us to talk about just in that small segment of your story. So what was it like being in Wuhan during the shutdown?
Yeah, I was not in Wuhan. I was in Shanghai, so luckily.
Oh, that's right. That's right. What was it like that being in China?
Yeah. But I have to say, in China, the citizens were definitely more disciplined in a way that probably because China 15 years ago, it's actually 17 years ago, was hit by the SARS outbreak. So people quickly, get PPE to protect themselves, at least face mask. Virtually everyone on the street over the 2 days wearing PPE. When every time you go in and out of a public space, whether it's a mall, restaurant, or the hotel I stayed in, they actually have used these thermal device to check my temperature to make sure that I'm not having a fever or something. So you suddenly, this is something at that time unwitnessed before, because Shanghai was a city of 20 million plus people. Yeah. Wuhan, the epicenter, had 11 million people. To lock down such a large area, that magnitude was unbelievable.
Yeah,
so
I bet.
saw the severity of the challenge back then.
I think it's incredible that you had such a first look compared to many of us in this country. And as a health innovator, had a jump start to be able to, kind of start to let the wheels turn, right? And start to ideate really quickly on what your team could do to help this crisis that obviously, you anticipated would be making its wave over here.
Yes, absolutely. Well, we deal with the emergency care professionals, so speed to get things done is essential. Mm-hmm. I think we were able to roll this out in just 2 days to all of our users, and we started seeing usage coming immediately. And today, as of yesterday, May the 14th, we have successfully triaged more than 1,600 suspected COVID patients for hospitals in 13 states.
Wow, that's incredible. It really is incredible. I mentioned this to you before. I think that you must have some incredible future and plans for you to be able to, survive being in China and then New York and not even get sick. It's fantastic. Lucky you, right? Very fortunate. Very fortunate. Yeah. So, kind of diving deeper into, I want to kind of dive deeper into what was Tweeage before COVID? What was your pre-COVID market strategy as well?
Sure. So Triage in the beginning was designed to help first responders and hospitals to accelerate life-saving emergency care. And it's hard to believe that we're in the 21st century, and for emergency care, people are still using outdated radio communication and pen and paper to record everything, right? So early on, we think we came up with a very nice solution to help them transform their emergency care communication. We use a freemium model to help first responders, who are often underfunded, to use this solution free of charge. And then the hospitals pay a subscription fee to receive the data. So from very early on, we established a network-based platform solution to interconnect these two parties together. And it's been working out well. And today we have powered close to 400,000 emergency transports.
Okay. So what was that like in the early days of trying to figure out what the right business model was going to be for you? What were some of the considerations and some of the things that maybe you've tried, or maybe this was the business model that you originally set out to go to market with?
Right. So for any startup business, from 0 to 1 and 1 to 2 are the most difficult part because we didn't have enough credibility to show customers why this could work. The concept sounds nice. In the beginning, we were very flexible to work with our customers to engage pilot trials without being greedy to just focus on the revenue model. But once we're able to get nice customer reference and usage, we became more confident to refine our business model. Today's business model has changed significantly from what we first came up with. We were more idealistic, like many other first entrepreneurs, startup companies in early days. But we, have the discipline to listen to customers, to not be stubborn, and be adaptable to the market voice and customer voices.
So that's something that, we talk a lot about here on the show is, product co-creation and the benefits, the incredible benefits of that. So, let's just kind of walk down that process a little bit. What was it like for you in that co-creation process?
So Tweeage actually was debuted from a hackathon, healthcare hackathon, sponsored by a very well-known Harvard-affiliated medical center in Boston. So during that time, we had a group of people. We had EMS professional, we had a software designer, we had physicians, all together trying to create a problem. And so the light bulb went on when first the EMT was complaining about how efficient the receiving process is at a hospital EDs. And the doctors jump on and saying, wait a minute, we never got enough information. So that's how the initial idea start to happen. Now, just like many business, it doesn't just stop there, right? The team decided to 3 out of the 11 people decided to test out the venture at a healthcare accelerator in New York. That's how the original story got started.
That's incredible. So talk about, starting with the problem instead of starting with the technology. And I think that that's a big difference for companies and kind of what sets them on a path for success versus failure.
Yeah, absolutely. I think digital health, healthcare IT, or digital transformation, they're no different from the regular transformation. It's just technologies allow us to make everything simple and make the solution easier for people to adapt. But fundamentally, we still need to start with a problem and come up with the benefits first.
Yeah. Yep. So John, as COVID has happened over the last, couple of months, health innovators have been at different points in this process and been able to pivot and react and respond in different ways. How did it impact your business? You were already, working with emergency services. And so, what did you need to pivot?
Yeah, that's a great point. So I think, as many of the experts said, that this is the greatest time to start a business or really fundamentally rethink our business model. So we quickly actually wrote out a long-planned telehealth solutions, and we're able to test with the various customers to come up with a different solutions to work with them. For example, traditionally we would sell to hospital users, but in this cases, hospitals are slower to react due to unfortunate situation of a staff furlough, or just clinicians are diverted to some other COVID-related work. But we were able to talk to physician groups to come out bypass way, instead of focusing on the larger contract with the customers, to utilize the opportunity to build relationship. First, let our customers were there, and we're trying to address their specific needs to deal with the COVID. We were actually able to come up with a model to help the ER physician groups and EMS professionals to use triage not just as a communication triage tool, but as a semi-documentation tool for them to deal with the COVID during this situation as well. For example, a lot of first responders during this unfortunate time are doing a lot of charity work. And these are our true heroes. They work really hard, and without even knowing their efforts and sacrifice will be properly compensated. So they need a quick documentation tool that allows them to capture patients' demographic, insurance information, and certain clinical information in rich media, such as secured photos or videos. And their current documentation tools do not allow them to tap into this kind of challenges easily. And triage traditionally does not serve as a tool to do documentation either, but we were able to talk to them in a short period of time, come up with an alternative solution to help them address that. I think that's going to help a lot of the first responders deal with this challenge right now. Yeah.
So, it sounds like there are a number of different things that have worked in your favor, having a head start on knowing this crisis is on its way, having worked really hard previously to penetrate some aspect of the market and have some established customers that were open and willing to collaborate with you on how you could solve their new problems that they were experiencing. A lot of the health innovators that I talked to, depending on where they were in the process, some of their target audiences have just closed the doors. Whereas other folks like you, those doors with existing customers are still open, and they're kind of like, hey, throw me a lifeline. Like I already have trust established with you. You're already delivering some value, but my needs and my priorities have changed. And so creating a bit more of an open door for that kind of collaboration and co-creation together, which is really exciting for I think for health innovators, because you get a chance to make a difference, which I think is a big part of why you got in the business anyway, right? Make an impact on lives.
Absolutely. Yeah, I think the challenge is universal. I'm not here to say that some of our contracting discussions not being slowed down due to budgetary issues or just many other challenges. But I think, at a minimum level, this is a great time to build relationships with customers within the healthcare system. There's a time that, I think that we shouldn't be short-sighted just to make them feel we're still trying to sell them something, but utilize this time to reassess our business strategy and offer them help. Sometimes it may not be specific, and don't be turned down. You reach out to 10 customers, maybe 7 of them won't respond, but the other 3 of them may. And they will remember during challenge time who's reaching out to them. We even actually assembled some PPEs, a face mask, a facial shield to support some of our local hospital customers, just because genuinely, we, as a part of a citizen in a community, we want to help our healthcare providers. So show your relationship at this time and willing to help in some way. People will really remember it over the long run.
I think that is a very important sales strategy for this time and this period is to cultivate that relationship, and maybe that be the end goal right now. Like you said, not selling them something because now is not necessarily the time. I think that, like you said, if you have something that can meet their needs right now, then we have an obligation to give that to them, to sell that to them. But at the same time, with other folks, to cultivate that relationship is really where I think I want to say where organizations should pivot to, but really building relationships should have been part of our sales strategy all along, right? It's just kind of like the duration of that is changing a little bit.
Right. Relationships really go the long way. And if you recall, Roxy, about 2 years ago, 2.5 years ago, Amazon actually quit their trial to penetrate the healthcare, especially hospital logistics procurement system, because they realized in the B2B setting, particularly in healthcare, it's not all about efficiency, but often it's about a relationship. And this is what Amazon is not good at, because they are often a massive, efficient platform, but they don't have much human touch, right? So this is what, unfortunately, that I don't think AI or anything can truly replace, because it's a human nature that you like to get some information from a real person versus just Google it online. So I think this is a great time to build relationship and ask for advice, right? At the one time, advice are really valuable compared to just a single contract.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. What are some other, sales strategies or things that you've done differently with doors being closed and, hospital systems being busy? Is it predominantly asking for advice? Like, how are you getting in front of them?
Sure. I would say, in general, you want to get in touch with you. Often it's not about giving them a blowout kind of pitch, but consistency in a way that the sales is an art. Selling is truly an art because you have to engage your customers carefully to get a sense of the boundary. It's almost like you're making an art craft. Do you put too much force or you put little, right? And you don't really know that until you keep trying. And you kind of like get into that comfort zone with that person. And, always respect what they say. If they tell you not to follow up too much, don't do so. If they tell you follow up with me 2 months, you do that in 2 months. But meanwhile, utilize other content marketing strategy or share some news to increase the chance of peer-to-peer influence. We always let our customers know some other good news that we received from existing customers, whether they have a new way of using something or Triage is doing something different. And also think about how to offer them value. Often it's directly related with our solution. Sometimes it's not. So there's not a cookie answer to do that. But first, you never know if you don't give it a try, right? Number two, it's okay if they say no. And number three, you got to really be persistent in a way that doesn't irritate people enough.
Yeah.
And it's okay if one or two don't like your approach, as long as the vast majority of them acknowledge what you think. And the other thing, very important, one thing I learned in this business is I've been running Triage for 5 years on top of my previous career. Often people don't buy right away. It's not because they don't like your solution, but maybe timing isn't right, whether it's a budgetary issue or they could be very busy with the other initiatives. They just don't have the bandwidth to engage your solution right now. Think about it often that some other people trying to sell something to you when you're busy, especially in B2B setting. So timing isn't right. I don't think in healthcare communication is very transparent, right? Often people don't tell you, you just don't hear back from them. But that doesn't mean don't get discouraged. Keep trying occasionally, and sometimes when timing is right, whether they're influenced by the competitors or industry peers, opportunities will knock the door again. Will be open again.
Yeah. So, John, you touched on something that I think is so important is, you can have a sales process and a sales strategy, but really the goal is to, as you're cultivating that relationship, to get to know that person specifically and not treat all sales opportunities or all business relationships the same because everyone is different. I am a very high D, fast-paced personality. Like, I want people to ask me if I'm ready to buy, because I'm making that decision right now. I don't dilly-dally. I'm not, evaluating my options over several months, but not everybody's like that. Other people, if you go in and you ask for it, they are offended. They are annoyed. they want to think about things. And like you said, me thinking about things is just maybe my personality. I'm cautious. I'm a little bit more risk averse. I'm thinking about this process and this decision that I'm making, but it doesn't necessarily mean that it's a no. Yeah. So
Absolutely.
Being able to ask those questions up front to be able to understand kind of what bucket those prospects fall into.
Absolutely. So think about this, in a clinical setting, you have the triage nurse who will ask patients a few questions to narrow down whether, what kind of specialty you need to see or what kind of a problems, right? So in sales, there are a lot of, whether you call it probing or in clinical setting, called a triage. There are many different customer profiles, modules that we can learn from. Certain customers are analytics. They like to take time to think, analyze. Some customers are like you, could be more straightforward, and some of them are more emotional. Some of them are truly value-based customers. Like myself, you like to look for what's the best, and, price, expensive, cheap are really relative depending on the products you look at. So I think it's important to understand who your customers are and also understand what the purchasing process is. Unfortunately, in the B2B sales cycle, you deal with a lot of variable parts. There's so many different decision makers, right? You need everyone to say yes, but only takes one no. So to be efficient, you could decide whether you need to decide whether that prospect is the right person you need to talk to, or that can make the decision or being a very important contributor part. If he or she is not, then try to utilize the selling opportunity to have that person commit to bridge you to the next person, right? Or to look at the selling process to have a mental expectation as our experience goes on, knowing how long it may take, and set up a more realistic goal, but more importantly, have a portfolio strategy. So in a way that you have a rolling pipeline that you can close every month. Although it takes time, but this is just a necessary part that we all have to live with in a B2B setting, especially in healthcare industry.
Yeah, and I think that no matter how awesome your technology is, no matter what incredible problem it solves, it doesn't sell itself. And so, it seems really obvious, but so many times I see health innovators over-invest in the technology and leave very little resources for marketing and for sales, and just really doing themselves a disservice. And it sounds like part of your winning strategy has been appreciating those areas of the business and investing in them.
Yeah, this is so true. So the business sector Triage is in, like many others, is really defined as tech-enabled services. This is so true for especially SaaS-based business model in a B2B setting. You really have to devote a lot of energy on the service part to make sure people stick with that. Because customers, especially healthcare professionals, they have so many different variables they have to deal with. Often you're fighting for a share of their mind. Right? Yeah. Even though an organization may have adapted technology, but you really need to manage the change part well, right? Change management is another piece of art that you have to find a way to align incentive, get the right people in the room to set the tone, and still handhold them. Now, some solutions are easier, some solutions are more complicated. Triage is a solution that's as easy as can be, but we see that unfortunately all the time. Change management in healthcare is never easy. Our healthcare professionals are heroes. They're experts in the clinical, doing things in clinical setting, but often not the best to adapt a new workflow technology to get used to what they do. So don't let this part slip through your view. And the customer success is critical to build a long, sustainable business.
Absolutely. Yeah. So many times I see health innovators kind of think the sale is the end, right? And it doesn't end there by any means. The service part is so incredible, especially when, I think it's always really important, but especially when you're in the early stages, because that positive experience of the post-purchase experience, right? That positive post-purchase experience is so incredibly important to that word of mouth marketing that crosses the chasm from the early market to the mainstream market. So it's critical. It is the key ingredients to be able to grow and expand into more of a mainstream market.
Yes, definitely. The nice thing about SaaS-based business is that there's an annual recurring revenue, right? So while you're collecting that revenue, don't forget to deliver the service also.
Right. Exactly. So John, as you what is what's next for Triage as you think about, we're in May now, so we've got a little more than 6 months left of the year, and there's so much unknown and uncertainty in this particular climate that we're facing. What is on your mind? What's keeping you up at night, and what are you planning for?
Sure. So we're already thinking about the post-COVID strategy, how we can make the solution easier to roll out. We have to look at the part of the strategy as what they call the platform positioning, right? want to offer a cluster of solutions to be well utilized by our current customers, because that, when you sell or introduce products to your current customer, the cost of acquisition is much lower, the sales cycle is much lower, and the profitability is also much better in general.
Yeah. Yep.
And we also use our current customers as a testing ground. Things such as, what would the scenario looks like post-COVID? And this is a great time that, whether industry experts or customers have more time to talk about what's going on, their pain points. So we already started to think about these things. If you ask me what keeps me up at night is really think about what the best way to recruit talents and keep talents. I think that's all the startup companies or, semi-matured company or even matured company should think about what we can offer during this challenging time, not just as a company trying to squeeze out more productivity while everyone works at home, but really there help them to make them feel that you truly live by your culture, and also make them feel that they're part of the family.
Yeah. Yeah. So one of the things
and also,
go ahead. Yeah.
Yeah, I was also going to say this is a great time since the market, the supply and demand dynamic has shifted a little bit over the pre-COVID. So this is also a great time for us to tap into additional talent since there are more people available now.
Yes, exactly. Definitely. It's really interesting. I was just going to say, so Legacy DNA is the company that I started 10 years ago, and we've been virtual since day one. So in a lot of ways, it's been business as usual for us. And as a leader of a virtual company, it's very different when you're leading a team that you can walk to their desk or walk to their office. And so there's it's different leadership strategies and techniques that you use to be able to create that culture or disseminate that culture through Zoom meetings like this, right? And in a virtual environment to make people feel like they're still part of a family and still connected, and inspired and encouraged to be part of the greater mission that's happening instead of disparate parts.
Yes, absolutely.
Yep. So I see those leadership skills being different leadership skills being required by all business leaders, not just healthcare innovators.
Absolutely.
Yeah. Yep. What are the opportunities that you think that are before us? So you mentioned that this is really fertile ground for us to be able to collaborate with our customers. How are you doing that? That's kind of one of the questions that I hear often. How is that being done, especially as we cannot be face to face?
Yes. So the good news is that everyone, expects you to do it virtually, right? So the traditional status quo just changed. And I keep saying this is a great time to start a business or really rethink the business model, because the sense of urgency in the multiple layers of the barriers in many solutions, if you are tackling the right problems, have been tiered down significantly. We've seen a lot of situational, even with our own COVID situation, the contracting time, the lead time has just reduced dramatically because people need something quick and urgent. So think about area like this, even though your solution is, let's say, stuck with a particular issue that's not a priority, talk to your customers. If GM can make a ventilator, maybe your engineer teams can build something for the customer that can be used immediately also, right? So we all have to have this kind of mindset to be nimble and agile to the market dynamic. So I think that if you reach out to customers, say, I understand my solution is not on the top of your priority, but tell me a couple of things that really bothers you right now. Maybe we can build something for you in a short time and let you try it free of charge, right? So you offer something like this, and healthcare professionals, administrators, they are tied up with constrained resources also. So this is something that may make them think again. Again, not everyone will respond. Not everyone will sign up right away, but you may get some unexpected customers. But more importantly, even the people don't sign up, they will remember that's what you offered at that time.
Yep, absolutely. So John, as we wrap up here, what are some of the lessons learned as being an entrepreneur and kind of going through this journey, and that you would want to share with our listeners?
Yeah. I say never give up. Resilience is the most important thing. And also, I practice this a lot. I talk to various advisors, mentors, or people I look up to during this time, just learn how they cope with the situation, right? Let's be honest, after being at home for more than 2 months, everyone's get cabin fever, homesick at this point. So it's important for us to keep a positive attitude and also think about, what's the best way to cope with this. What are the things, not just for us, but for also our team members. And also, this is a great time to learn, whether from some formal program, from the best practice, and because people simply have more time to share and they want to talk to someone also.
Right, exactly. Well, I think that's great wisdom. Thank you so much for your time and sharing your insights with our viewers and listeners today. How can folks get a hold of you if they want to reach out to you after the show?
Yeah, I'm very active on LinkedIn and other social media. So feel free to send me a message to my LinkedIn. You can find the name John Hui. Last name is Hui.
Awesome. All right. Thanks, John. Appreciate it.
Thank you very much, Roxy.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.